The topic we are going to discuss today is uveitis and spondyloarthropathies. The spondyloarthropathies are a group of disorders featuring HLA B27 positivity and enthesitis as common factors. There is often a family history of one or more of the group, uh, which comprises ankylosing spondylitis, undifferentiated spondyloarthropathy, psoriatic arthritis, reactive arthritis like Rita syndrome, and spondyloarthropathy with inflammatory bowel disease like ulcerative colitis and Crohn's disease. They are often referred to as seronegative arthropathies uh, in that rheumatoid factor is not present and pathophysiological basis differs. The American Uveitis Society has recently endorsed the use of biological blockers such as infliximab for second-line systemic immunosuppression in vision-threatening chronic uveitis. Uh, First of all, ankylosing spondylitis. It is characterized by inflammation, calcification, and finally ossification of ligaments and capsules of joints, the resultant bony alkylosis of the axial skeleton. It more commonly affects males, of whom 90% are HLA-B 27 positive. The systemic features, presentation is most commonly in third to fourth decade, with the insidious onset of pain and stiffness in the lower back or buttocks. Spondyloarthritis causes progressive limitation of spinal movements, and eventually the spine may become fixed in flexion. Spinal stenosis and fractures may occur. Enthesitis is characterized clinically by inflammation and pain at ligamentous attachment to bone. Cardiac complications are rare. Radiology of sacroiliac joints shows juxta-articular osteoporosis in the early stages, followed by sclerosis and bony obliteration of the joint. Calcification of spinal ligaments give rise to bamboo spine. Radiological changes often predate clinical symptoms. Now, this is where you can see the condition, and the X-rays show sclerosis uh, and bony obliteration of the sacroiliac joint. Ocular features include most commonly acute anterior uveitis, which occurs in 25% of patients of ankylosing spondylitis. Approximately 25% of males with acute anterior uveitis will have uh, ankylosing spondylitis. Either eye is frequently affected at different times, but bilateral simultaneous involvement is rare. There is often no correlation between the severity and activity of eye and joint involvement. Chronicity occurs in a few patients. HLA B27 positive ankylosing spondylitis patients tend to have worse disease across a range of parameters, including earlier onset and greater intensity of inflammation with an increased frequency of complications. Other ocular features include um, scleritis, episcleritis, keratitis, and mechanical ptosis. Now, reactive arthritis, also known as Rita syndrome, is characterized by a triad of nonspecific urethritis, conjunctivitis, and arthritis. Around 75% of patients are positive for HLA-B27 as opposed to 90% in ankylosing spondylitis. A range of ineffective active agent can trigger the syndrome, which develops in 1 to 3% of men after non-specific urethritis and around 4% of individuals after enteric infection caused by a range of organisms, including Shigella, Salmonella, and Campylobacter, chlamydia, pneumonia, respiratory infection, and others may precede reactive arthritis. Now, we have to see systemically, the presentation is with acute onset of malaise with fever and dysuria 1 to 4 weeks after a linked infection in a patient aged between 20 and 40 with arthritis that may be preceded by conjunctivitis. A variety of other features may be present, though not always the defining trait. Uh, Peripheral oligoarthritis is acute, asymmetrical, and migratory. 2 to 4 joints tend to be involved, most commonly the knees, ankles, and toes. Patients with uveitis secondary to the various spondyloarthropathies are often HLA B27 positive. Um, Now, spondyloarthritis affects about 50% of the patients, manifesting with low back pain. This sometimes becomes chronic. Enthesitis manifests with plantar fasciitis, Achilles tenosynovitis, bursitis, and calcaneal periostitis. Reactive bone formation in the later may result in calcaneal spur. Mucocutaneous lesions include painless mouth ulceration, circinate balanitis, and and keratoderma blennorrhagica. Skin lesions resembling psoriasis involving the palms and soles. Genitourinary involvement includes cervicitis, prostatitis, and epididymitis. Otitis occurs in about 1 to 2%, whereas cardiac involvement in ankylosing spondylitis has seen to be very rare. Uh, Important thing is involvement of soles and palms. Uh, Here you can see keratoderma blennorrhagica and reactive arthritis. In the eye, the 50% of the cases with the urogenital inciting infection and 75% of enteric uh, rheumatoid arthritis syndrome. Conjunctivitis is very common and classically follows urethritis but precedes arthritis. The inflammation is usually mild, bilateral, and mucopurulent with a papillary and or follicular reaction. Spontaneous resolution occurs within 7 to 10 days and treatment is not required. Some patients develop peripheral corneal infiltrates. Acute anterior uveitis occurs in 20% and epic sometimes occur. Now, psoriatic arthritis, up to 40% of patients with psoriasis develop arthritis. Arthritis is more common in whites than in other racial groups, and affects both sexes equally. There is a first degree family history in 40% or more, and many genetic markers have been identified. Now, systemically, presentation of psoriatic arthritis is usually in middle age, later than skin features. There are multiple types of psoriasis. The most common is the plaque type, uh, which is characterized by well demarcated, uh, raised, silvery, inflamed plaques on the scalp, trunk, arms, and legs. Number two is the psoriatic erythroderma, featuring widespread exfoliative skin changes with associated inflammation, and pustular psoriasis is another kind, inflamed but non-infectious pustules, limited or generalized in distribution. Nail changes or dystrophy, including pitting, transverse depression, and oncholysis. Arthritis is typically asymmetrical and involves distal interphalangeal joints, sausage digits, some patients develop enthesitis. Um, then in here there is a plaque formation in cases of plaque psoriasis, and arthritis and severe nail dystrophy uh, is observed. Ocular features, acute anterior uveitis is approximately in 7% of cases as opposed to 20% in readers, and conjunctivitis, marginal corneal infiltrates, and secondary Sjogren syndrome may occur but are uncommon. So these are spondylo